As three kinesiology students, we are interested in movement patterns and injury rehabilitation. In the United States, there are more than 200,000 ACL injuries every year, half of which require reconstructions. A significant amount of time and research have been put into surgical procedures and rehabilitation programs in an effort to minimize recovery time.
Some of this research is aimed to find the optimal time you should delay getting surgery after tearing your ACL. To do so, the study isolated 3 groups based on the length of the delay for each individual. To compare these 3 groups, the researchers measured the level of arthrofibrosis in each patient. This leads to stiffness in their knees after surgery. In order to measure this, the researchers assessed the range of motion in the patients. It is always a major goal in injury rehabilitation to restore the patient's range of motion as much as possible to ensure maximum flexibility. The results found that patients who had their surgery a week or less after the time of their injury had more arthrofibrosis and therefore less range of motion than those patients in group 3. As you can see, through the use of research, we've gained the knowledge that delaying ACL surgery for around 3 weeks or more after the time of their injury, it had a positive effect on the patient's range of motion after their surgery.
There are 4 common ACL reconstruction procedures done today. The patellar tendon graft is the most common because it is stronger than the ACL and allows for a bone-to-bone interface for healing. However, it does have a high incidence of knee pain, a larger scar, and the risk of patellar tendon ruptures. The hamstring tendon graft is a newer technique and requires more time to heal because of a soft tissue to bone interface. However, it is good for younger patients as the growth plates are not disturbed and the quadriceps do not atrophy. Cadaver grafts allow for a short recovery time. However, there is a risk of contracting diseases from the cadaver and the cleansing techniques degrade the graft tissue. Synthetic grafts could be able to replace natural tissue. However, the technology is not there yet. Currently, the grafts permit for the quickest recovery. However, their strength degrades over time due to friction at the bone tunnels.
These different types of grafts have a lot of different applications in the general population. For example, studies have shown that by taking the tendon graft from the quadriceps tendon patellar bone as opposed to the traditional bone patellar tendon bone, they found that there can be up to a 30% decrease in knee pain of the patients after surgery. With an average of 100,000 ACL reconstruction surgeries every year in the United States, this information has potential to increase the well-being of thousands of people. We can also look at the way the research has affected the specific way the surgeries are performed. Again, many studies have shown that by folding the tendon to create what's known as a double bundle, the knee will have greatly increased anterior and rotational stability for many years after the surgery is performed. Without the research put into finding the results we have today, ACL reconstruction wouldn't be nearly as effective a surgery as it currently is. Being one of the most common sport injuries, this has major clinical significance.